Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer is proud to continue our exploration of the new ultra-modern facilities brought to our community through the efforts of our local nonprofit hospitals called the Fremont Rideout Health Group. Several months back on a previous Medical Explorer program, we visited the construction site at the new Cancer Center in Marysville. By now, the new Cancer Center is completely operational, and hundreds of local patients have benefited from the convenience of having these services right here in town. Tonight, you and I will have the chance to go on a private tour of the new Cancer Center and explore behind the scenes of this fantastic new local facility. In the pharmacy corner this evening, our award-winning neighborhood pharmacist Bob Church will update us about flu vaccine. Is it a wise idea to receive yearly flu shots to prevent catching the influenza virus? The year 2001 made everyone aware of the flu vaccine because of the early vaccine shortage, and many patients were unable to get the vaccine early in the flu season. Could these flu vaccine shortages happen again? Well, we'll learn the answer to this question and others about the flu vaccine in tonight's Pharmacy Corner. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Since we have a lot of ground to cover tonight, let's get right into the Pharmacy Corner. As you know, the purpose of the Pharmacy Corner is to keep you up to date on the latest information of the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in our Pharmacy Corner is award-winning pharmacist Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
Flu is a term that's sort of used loosely to describe all kinds of illnesses, colds and things. Can you give us a little bit more of a precise definition of flu?
Sure. I think you're absolutely correct. You and I talk to people all the time who don't feel well, and they say, oh, I've got the flu, or I'm getting over the flu. And we know that it really isn't the flu because the flu season hasn't started. And the symptoms don't match the flu to begin with. Flu is actually a viral respiratory infection. It's not a bacterial infection, at least not initially. And it's characterized by an abrupt onset of fever, headache, muscle aching, malaise, fever, and a persistent, non-productive cough, usually associated with sore throat. So that's really what the flu is. But people have all kinds of ideas of when they're suffering from the flu, and most of the time they don't have the flu.
You really can tell when you get that because you're really sick.
Yes,
and
you are.
It's certainly a lot different than a stuffy nose and a little bit of a sore throat that people get. So.
Absolutely.
Why is the flu so dangerous to some people?
Well, the reason is that because a lot of people are at risk. If you are elderly, or if you have a compromised immune system, like if you're taking certain drugs that reduces your immunity to infection, if you have certain respiratory diseases or cardiac conditions, you aren't as strong in your immune system as like a young adult would be. So you are more susceptible to the flu viruses. And every year they try and match those viruses with what they think is going to be circulating, but the match may not necessarily be right.
Now, in the 2000-2001 flu season, getting the vaccine was a big news story, and we saw newspaper articles with people lined up to get the vaccine and people that really couldn't get it.
Sure.
Is that going to happen every year?
I don't think, theoretically it could happen, but history doesn't show that that's going to happen every year. There was sort of a unique set of circumstances for the 2000-2001 year. They had trouble identifying and producing the vaccine, number one. Then there's very few companies that do this. There's only like 3 companies that actually produce this vaccine. One of them had a physical plant problem, which closed one of the facilities to do this. So the situation sort of snowballed, and then it was, well, the vaccine's going to be available at a certain date, and that date didn't materialize. Then there was another date set, and there was some shipped, but not much. And so a lot of programs to provide the vaccine had to be canceled, and it created a real problem. Ultimately, it became available.
Sure. Did you have a pharmacy program at your pharmacy giving them out this year?
This year we had to cancel.
Oh, because the supply was so hard.
We had 3 dates that we had set, had to cancel all 3 of them.
I know, because you've saved a lot of people suffering from the flu over the years with those programs.
We've had an excellent turnout for those flu.
Now, kids get vaccinated in young childhood for diseases, and they don't have to do it each year, like mumps and measles and chickenpox. Why do we have to get a flu vaccine shot every year?
Okay. Well, as I alluded to earlier, the situation changes from year to year, and the vaccine is based upon the best projections of what 3 viruses to include in the vaccine to prevent you from the viruses that are going to be circulating in the future, in the year ahead. So that's a consideration. Also, once you have your flu shot and you build up your immunity, that immunity starts to dissipate after several months after having the shot. So for those 2 reasons, you have to have your shot every year if you expect to be able to get through the season without getting the flu.
It's interesting how the human body, though, can detect antigen to the mumps and measles, and you only have to get that early on, and it stays with you for your life. The T cells and all those things change, but it doesn't really work as well for flu vaccine, flu virus and things.
No, it doesn't.
So viruses are different, as we know very well.
Absolutely.
Can the vaccine actually cause the flu? Because people commonly come in, you give them a shot, the next day they say they have a cold and we gave them the flu. Can that happen? I mean, is that something that would be going on here?
Well, I know there's going to be a lot of our viewers tonight, they're going to disagree with what I say. But no, the flu vaccine does not give you the flu. It consists of ineffective, dead viruses that build an immunity, but it does not give you the flu. And I know lots of people are going to say, but I've had the flu shot, and boy, in 2 days I got the flu. Well, what has happened is they may not have had the flu. They did get some respiratory infection of some sort, which they had had exposure to previous to getting the flu vaccine. Usually, as far as a reaction to the shot itself, you may get some tenderness at the site of injection, which might last a day or 2, but other than that, that's it.
What time of year should it be given for the best effect?
Usually from about the 2nd week in October through the end of November, and you don't want to get it, hopefully, any more than 2 to 4 months before you're going to be exposed.
Is there anybody that shouldn't get the flu shot?
Well, yeah, there's a few people. Those folks who are allergic to eggs, because as we know, this is where sort of the viruses start and they're produced, and so if you're allergic to eggs, you don't want to do that. If you're allergic to the preservative thimerosal, which they use, and some people are allergic to that, you should not have it. And if you're suffering from an acute illness where you've got a fever associated, you should wait until that's over before you have the flu.
Just to put you on the spot, do you take a flu shot each year?
Every year.
Yes, so do I.
And I found one this year, even though I wasn't giving them at my store. I did find one.
Great, yes, so did I too. And we actually got it here, so that was pretty good. Bob, as usual, that was very useful information and important information. And I hope that our viewers will discuss their concerns and questions about the flu vaccine with their physicians and pharmacists when they have the next opportunity. We look forward to you returning to the Pharmacy Corner on future programs. Thank you very much.
Thank you.
Now, on with the Medical Explorer. I know that you're eager to see the new cancer center, but before we head to Marysville, let's meet again with Mr. Tom Hayes, the CEO of our area's hospitals, and learn more about new things happening at Fremont and Rideout at his administrative office in Yuba City. I'm proud to have back Mr. Tom Hayes, the CEO of Fremont and Rideout Health Group. Thank you very much for letting us come back to your office.
You're welcome. Yeah.
I'm so proud also of the community and what you've done with developing the new cancer center. Can you tell us a little bit about the history of how this all came to being?
Sure. The cancer center came about, at least the idea for the cancer center came about at least 4 or 5 years ago. We had discussed within our board the need to provide better services in our community, and the topic of cancer care came up, and the fact that a number of patients were going out of town for care. So we felt at that time that we should explore the possibility of building a cancer center. And so from that, we developed the current cancer center that now has opened.
And who's involved? I know the doctors in the community here are, but others are too.
Yeah, we have the Cancer Center is a joint venture with Fremont Rideout and UC Davis. UC Davis is a partner in the Cancer Center and has contributed half the capital to the Cancer Center, and as well will share in half the losses or revenues that are generated from the Cancer Center. The advantage of having UC Davis participate, of course, is to access their vast array of specialists that they have in their cancer program, also to access additional capital, and also for us to be able to participate in their clinical trials, which we would never be able to do in our community without some sort of affiliation with a major teaching university.
So one of the big advantages here is that people that have these very devastating diseases no longer have to drive to Sacramento.
Yeah, absolutely. There are, just to UC Davis alone, there are over 600 patients a year going for treatment. Those patients now will be able to stay here in this community, especially because the Cancer Center has some very sophisticated equipment that is state-of-the-art, and so it's been very valuable for the Cancer Center.
Well, the community continues to grow, and so does Fremont Rideout Health Group.
That's right. Yeah, we have a lot of different projects going on right now, and Cancer Center is one of those, and as well as cardiac surgery. So,
look forward to talking to you more about that in the future, and we'll want to come back and explore that for our program as well.
Great. Great.
So you have a demonstration or a tour set up for us today?
We do. Candice Wilkins, Assistant Administrator of Ambulatory Services, will be taking you on that tour.
Great. Thank you very much, Tom. Hi.
Peppercorn.
Thanks for having us over.
Thanks for coming.
And Tom said that you're involved with the administration of the operation of all the outpatient services at Fremont, right?
Services, yeah. Cancer Center is one of my departments. Some other departments in ambulatory are rehabilitation, occupational health, home health, Feather River Surgery Center.
Oh my goodness.
Clinic. Yeah, there's a few. There's a few. This, however, is the latest and greatest in my repertoire, and we're very proud of the Cancer Center.
Well, walking in here today, I feel like I'm coming into a palace of royalty. It's just incredibly well done and a comfortable feeling for the patient.
Yeah, it is a beautiful building. We wanted to create the feeling, not so much of a palace, but more of a residential type of feeling to it. If you notice outside, we wanted to blend it in with the surrounding area. We made it kind of look homey, more than clinical. And as you come into the waiting room, of course we've got fountains behind us, and we've got nice comfortable chairs. It's not your typical physician waiting room. We wanted to make people feel comfortable. When they're coming in for cancer treatment, they're sick, they're not feeling well, it's a devastating disease, and we just kind of wanted to surround them with some warmth and comfort.
Well, you certainly have done that. I wish I had your designers and architects back when I built my office in 1986.
I like them for my house.
It's really, really well done.
Thank you.
Now, you're going to show us around the whole center. Why don't you just tell us a little summary of what we will see today?
Well, the Cancer Center is 18,000 square feet. This is an $8 million project, and I think as Tom mentioned, it's between UC Davis and Fremont Rideout Health Group. What we're going to see today is a library for life, and I'll explain that when we're in there. The Cancer Center itself is split into kind of two sides. One is the medical oncology, and that's chemotherapy. And the other side is the radiation oncology side. That's where you get radiation. And cancer treatment is comprised of three basic treatment areas. One is chemo, one is radiation, and one is surgical oncology. Now, we don't do surgeries here. We do those in the hospital in Feather River Surgery Center. But post-surgery, the patients can come here and get all of their cancer treatments in one spot. So I'll take you through the whole building and show you how it's laid out.
Okay, well, why don't we get started?
Sure. To the right here we have some conference rooms, and we set that up. There's so many people that want to come to the Cancer Center and see it, and we can have conferences here. What we're entering now is the Library for Life. And you know, this is the only hospital I've ever worked in that has an actual fireplace in it. It's just beautiful. This is for cancer patients and their families to learn about cancer. This is a resource center. We'll have books and videotapes. And we'll also have computers in here with direct access to internet sites pertaining to cancer. And we will have volunteers in the building that can help people with computers if they can't get into the sites themselves. We're also editing what sites are available and on those computers in this center. We want to make sure that they're getting the right information. There's so much information there, sometimes it can get confusing, so we're going to make sure that they get the right information through this library. This library was put together with funds from the foundation of Fremont Rideout Health Group, and it was all charitable donations, and we had a golf tournament. We raised money for this library outside of the operational budget that we had for the Cancer Center, so we're very happy with that and thank the donations.
Well, I gave some money to that, so I'm glad I could say that too. Thanks. Where will we be going next?
Now we're going to go into the infusion center where they get chemotherapy.
Let's head over here.
Sure.
Right.
We're now in the infusion center. This is where patients get chemotherapy. When we looked at the design of this center, we actually had patient input and talked to former patients and current patients that were in our center getting chemotherapy. Some patients, when they're getting chemotherapy, wanted privacy. They wanted to be by themselves. They wanted to, just be quiet and think and not have a lot of interaction. So we made some bays over here that are just with one chair in them where the patients are all by themselves. We even have some private rooms where they can go in and close the door and get their chemo. Understand that chemotherapy can be anywhere from 15 minutes to 6 hours long. 3 to 5 days a week. I mean, they're in here a lot, so we wanted to make it really comfortable for them. We also have some bays that have 3 infusion chairs in them, and some patients said they wanted to be social and they wanted to visit while they're here for their 6 hours every day. They develop a camaraderie with each other, and